External cephalic version. Like a virgin, touch for the very first time. Y'all remember that Madonna song? My Madge voice sucks, but shout out to her. So speaking of touching, versions are typically performed by your OBGYN. They are performed in a hospital setting. External cephalic versions, or just versions, are performed when fetuses are in a non-vertex presentation. And what is a non-vertex presentation? It's when the fetus or baby is presenting any way other than head down. That is, the fetus can be transverse or sideline or breech. Either the feet or buttocks are the presenting parts in the pelvis. So, external cephalic version. The procedure itself involves your OBGYN placing both hands on your pregnant uterus, one hand on the fetus's head, the other near the buttocks, and attempting to roll or push the baby so that it flips into a head down position. Depending on how the fetus is lying, the roll may be either forward or backward. You may or may not experience discomfort during a version attempt. This depends on whether or not your uterus starts to contract due to the version attempt and the amount of pressure that your doctor is using to flip the fetus. If the first version attempt is not successful, there might be another attempt. If your uterus is contracting, you may be given medication to help relax your uterus. The most common medication given in this situation is terbutaline, or more simply, TERB. You may also, alternatively, be given an epidural, which serves two purposes. One, to relax the uterus, and two, to help with any ensuing discomfort. There typically will be some sort of fetal monitoring beforehand to ensure that baby status is reassuring, and afterward to ensure that baby is doing okay. This involves the use of external monitors on the abdomen to monitor uterine activity, looking for the presence of contractions, and fetal heart rate to ensure fetal well-being. There should be a bedside ultrasound that will monitor the baby throughout the procedure to ensure that the baby is moving in the right direction and that the heart rate remains stable. So what sort of flip are we doing here anyway? Front? Back? These are all things you need to know. So what makes you a good candidate for a version? Being multiparous, that is, it isn't your first baby. Having an adequate amount of amniotic fluid. The baby is not engaged in the pelvis. So what makes you a poor candidate for a version? This is not a singleton pregnancy. Versions should be done on single intrauterine pregnancies. So if you're having twins or triplets, it's a no-go. Low amniotic fluid level. Placental abnormalities, whether it be placental insufficiency, previa, abruption, etc. Any uterine malformation or fetal anomaly. While being obese certainly is not a contraindication, it certainly may make the version technically more difficult. The size of the baby, location of the placenta, as well as location of the fetal back are other factors that will impact success. So when is an external cephalic version done? Most versions are done at the 37-week mark. They are typically not performed prior to this due to the increased success rate noted at 37 weeks, as well as avoidance of preterm delivery if complications arise. If successful, there is a 3% chance of reversion, or baby flipping back to a non-vertex or head-down presentation. Success rates have been quoted anywhere from just over 50% to around 63%. It's probably worth asking your clinician what their success rate is. External cephalic version risk. While the whole purpose of an external cephalic version is to avoid a C-section, risks associated with it include things like the fetus reverting to breech presentation, ensuing labor, premature rupture of membranes, fetal distress or bleeding, or any other thing that might necessitate an emergency delivery. For those of you not comfortable with taking the risk associated with an attempted version, a C-section for malpresentation can always be scheduled at 39 weeks. For more information on external cephalic version, read the full blog post at AskDrAngela.com. Thank you.